Hello, we are from the group Troubleshooting and we will be presenting to you the uses of application software for doctors on public health management.
My name is Nur Akhil Natasha binti Muhammad Najih Leri.
I will present about introduction. The first one is history. The Information Documentation System or IDS unit in Ministry of Health was established in 1980 and the core business function at that time is for the planning and operations of health management information system for Ministry of Health. HMIS-E is an electronic reporting system for the collection, collation, and analysis of health information in MOH facilities. A web-based reporting system has been developed through which all health and health-related data from MOH facilities, non-MOH facilities, and the private sector are transacted to ensure timely and quality health information. The second one is the importance of HMIS. The HMIS would be used to keep track of health-related events and assess service quality at various levels of healthcare. The importance of patient evaluation is part of the concept of valuing patients' opinion in upgrading the quality of healthcare. Next is HMIS helps during the time of pandemic. The first one is a critical role in managing data and other information at the speed the situation requires. They provide essential evidence for taking action, making the best decisions possible, and adjusting policies to allow for better intelligence on actions to improve health. Second one, efficiency analysis can potentially be used to measure the performance of health systems in managing COVID-19 pandemic that may reflect the preparedness and response level of the country.
Hello and Assalamualaikum, my name is Shazwani and I'm going to talk about the MySejahtera application. MySejahtera is a free-to-use application developed by the government of Malaysia to assist in managing the COVID-19 outbreaks in the country. MySejahtera is used by the citizen of Malaysia and system administrator in the Minister of Health. The main users of the application software are firstly, the MySejahtera app assists the government in managing and mitigating the COVID-19 outbreak. Secondly, it helps doctors to manage vaccine dosage update on each person. Thirdly, once registration and self-health assessment is completed, your health status will be classified as low risk, casual contact, close contact, person under surveillance, suspected cases or confirmed cases. By having such access, it helps users in monitoring their health throughout the COVID-19 outbreak. Lastly, the application assists users in getting treatment if they are infected with COVID-19 by locating the nearest hospitals and clinics for COVID-19 screening and treatment.
Hello, my name is Naina bint Khalid and I'm going to talk about an app that uses help managing information system and its key feature. It is up to date. Up to date is help application software. Its key feature is first, vast information, second, evidence-based, third, user-friendly, and fourth, efficient.
Application software is fast becoming the patient preferred way to access their doctors and manage their appointments. Therefore, let's talk about the advantages of application software for the doctors on public health management. Firstly, it helps doctors to perform better patient care. This is because mobile health technologies enable patients to schedule appointments and connect to their doctors 24/7 for telemedicine visits. The healthcare industry constantly produces data. Therefore, health management information system help gather, compile, and analyze health data to manage population health and reduce healthcare costs. Therefore, the healthcare data analysis can improve patient care. Secondly, doctors can easily monitor patients' well-being. This is because patients often need treatments from different healthcare providers. Therefore, healthcare management information system such as health information exchanges (HIEs) allows healthcare facilities to access common health records. Therefore, remote patient monitoring enables doctors to use HIEs to track patient conditions in between visits and notify a doctor when the patient's biological data is putting the patient at risk. It is a big step forward in managing care.
Assalamualaikum and hi, my name is Nurunoha binti Nazaruddin and I'm going to talk about the disadvantages of application software for the doctors on public health management. Even though the system and application helps the doctor for their daily work, however, it could be lacking in some way. Hence, I'm going to mention about two our highlighted disadvantages, which are data privacy issue and low exposure. As we already aware, application software at the hospital or any other public health management are widely used by the staff and or for the doctors. And for some reason, it couldn't be highly protected as there is no other source for the staff or doctors to obtain the patient's information. Therefore, for patients, their data could leak as unauthorized sharing could happen to irresponsible users. Not only that, but protection of the data are easily implemented for all users and compatible devices. Next, the second disadvantage is it is low exposure. We could assume that it is low exposure as it may not be compatible with all devices. Not only that, but people who are less fortunate and older citizens, they are more likely not to use a smartphone and modern devices might be hard for them to use it. For the application software, it could be low exposure to the public. For example, our chosen application, which is My Sejahtera, is a recent application that was created by the government in order for Malaysian citizens to receive their vaccination dates and updates about the COVID-19 cases. However, people who are unfortunate or older citizens, they might not have an easy access of the application. In addition to that, it could be inaccessible to those who live in the poor coverage area in order to use the applications.
About the future of healthcare, it is artificial intelligence, or known as AI. First, doctors can efficiently diagnose and reduce error with AI. AI can predict and diagnose disease at a faster rate than most medical professionals. Second, doctors can develop new medicine with help of AI. The efficiency, accuracy, and knowledge that AI can provide beneficial to biopharmaceutical companies to drug developments. Third, doctors can manage medical data with AI.
Next, I'm going to mention about the future of application software for the doctors on public health management. I'm going to mention about advanced medical communication application software such as virtual reality VR and augmented reality AR is highly compulsory for the doctors in order to give a better services. Not only that, it provides a wide range of accessible services in medical field. It can help the doctor by providing a widely used for the trainings such as diagnostically relevant detail, orientation and anatomic structure for a better understanding for the doctors. Moreover, VR and AR it can help surgeons to plan their interventions and making them less likely to encounter surprises or feel unprepared. VR and AR are widely used in healthcare as doctor and healthcare specialists. It is because they use them in operating rooms and classrooms. For example, before performing an operation, surgeons can use VR and AR technologies to walk through the organs or anatomic structure that they need to operate or view a 3D models of challenging surgical cases. Therefore, it will less the patient's attentions from the painful stimulus. VR can be used to help medical professionals visualize the interior of the human body, and as for the AR, is used in the medical field of healthcare due to its distinctive features. Instead of visualizations using displays and sensors, one can see what goes inside the human body. Therefore, AR can help explain surgical procedures easily.
The last one I will present about conclusion. HMIS is a data collection system specifically designed to support planning, management, and decision-making in health facilities and organizations. The achievements that have been achieved by HMIS is succeed in making the affairs of doctors, nurses, and all staff that involved in the health of patients more easy. This also makes it easier for the community to manage the health problems that they face. That's all from our group. Thank you.